welcome to the Oral Health Podcast. In connection with National Smile Month, we are here bringing you bite-sized discussions with different people in dentistry on oral health and a variety of topics. So last time we focused on children's oral health. So today we're going to discuss adult and elderly oral health. We're going right through the generations today. And we're going to look at what as adults and as elderly people we can do to take care of our teeth and our gums. This episode again is being sponsored by Oral-B, and I'm joined again by Dr. Angela today. How are you?
I'm very well. How are you?
I'm brilliant. Yeah, it's it was sunny, and then we pressed record and the suns went away. So we'll make of that what you will.
Yeah, really rainy here as well. Thank you so much for having me back on.
No, it's fantastic. Pleasure's all ours. So we'll just jump straight in. For National Smile Month, we do a survey every year where we ask people all over the country a bunch of oral health questions, and it really got me thinking about how much do we actually know about our teeth? The survey's full of all sorts of different oral health questions, but one that caught my eye pretty much immediately was the question, when do you brush your teeth? Most people, 58%, said that they brush twice a day, once in the morning, once in the evening, when you should be doing it. But a lot of people said that they brushed less than once a week. Some said a few times a week. Some even said they never brush their teeth. And obviously this is quite a concerning statistic. And as well, something that was highlighted from the survey was that more people have been experiencing delays with access to dental care than any other health service. So that's higher than GP services, eye care, hospital services, mental health support, physiotherapy. Higher than all of that. Top of the list was dental care, which of course can be for one concerning from an oral health care standpoint, but also it really means that conversations like this with yourself, Dr. Angela, are very important, because if people are only brushing once a week or never brushing their teeth, we need to get the messages of good oral health care out there. So let's just take it right the way back to the bare basics of oral health care. What is the absolute minimum that all of us should be doing every single day?
Okay, so the best way to look after your teeth is to brush twice a day for 2 minutes. You need to be brushing last thing at night before you go to sleep with a fluoride toothpaste. After brushing, spit out and don't rinse it off. And then you want to be brushing another time in the day. So in the morning, or it doesn't really matter the other time in the day, actually. You could do it before breakfast or after breakfast. And that's to apply some more fluoride to the teeth to help protect them. Also, we need to be cleaning in between the teeth. So that's really important, because even if you're brushing really, really well, it doesn't get all those surfaces in between the teeth and under the gum line. So you should be flossing or using interdental brushes every day. So that's daily. And then trying to reduce how much sugar we're consuming as well. So it's not necessarily the amount of sugar that's the issue, it's the frequency. So what I would normally recommend is to stick to kind of water in between meals or sugar-free drinks, and reduce the sugar consumption to no more than 4 sugar attacks in the day, which does include all your main meals. And also really, really important is to make sure you visit a dentist regularly so that we can check your teeth, check everything is good, and give you lots of good advice.
Something that so we had, of course, Dr. Ben Atkins on a previous episode, and something he said that really stuck with me is, if you want to know if you've got any signs of gum issues after you've flossed or brushed interdentally, smell the brush. And after after he did that, I was like, I'm just gonna see. And I went in and I flossed my teeth and I gave it a sniff, and I was like, okay, that's right, but that's not what it should smell like. Yeah. So it does work.
that actually, that does help. Sometimes even when you can scrape the plaque off your teeth, if you haven't brushed it properly, and if you can see all the plaque on your finger, it's kind of gross. So yeah, definitely need to be doing that.
Yeah, and that sort of simple little thing. I go, oh, well, I've never ever had a filling, and I sometimes skip flossing, so clearly that's fine. It's actually not. Like, it just because you haven't had a cavity doesn't mean your teeth are clean. There's a whole bunch of in between.
Yeah, definitely. So sometimes you can get early decay starting on the teeth, and even early signs of gum disease that you may not necessarily feel like you have a problem, but if it was left to progress, then it could develop into something more serious.
Mm-hmm. Definitely. I don't know. I don't think I've ever, since I had braces, I don't really see them about as much. But those disclosing tablets, do they? How good are they for people? Do you think?
They're really, really useful. And some people think only children need to use them, but we actually in our clinic use them for every adult patient. The first time they come to see our hygienist, the hygienist will disclose the teeth and show them exactly where they're missing.
Hmm.
So I think I mentioned before, a lot of people, they clean the surfaces that you can see really, really well. And on the surface, it may look clean, but they're missing a lot of the really important areas like around the gum lines, in between the teeth, and on the biting surfaces. So the disclosing tablets are really handy because that will dye any of the plaque that you've left on your teeth, like bright pink or purple, and then you can see where to physically brush. Another useful thing with the disclosing tablets is you can use it to test yourself as well afterwards. If you think you've done a really good brush, then use the disclosing tablets, and then you can see where
See
you've
how.
missed. I actually done these kind of videos before, because I do a few YouTube videos, and I've kind of demonstrated how even if you just brush and then you disclose afterwards, you can see you're missing all those areas around the gums, and that's why you need to be using the interdental brushes and or floss. So yeah, really handy even for adults. So I do highly recommend them.
Obviously, probably the biggest bit of advice that you snuck in there at the end was go and see the dentist regularly, even if it's nothing going wrong that you think. Still go for your checks and make sure everything is tip top, because the last thing that you want to do is cause an issue or like get a cavity and then have to get a filling or even a removal, and you can just stop all that in its tracks if you go and
Yeah.
see the dentist 9 times out of 10 at least.
Yeah, so prevention is really important. A lot of dental issues are preventable. So if we can spot something early, it could prevent it progressing into something more complex. And if you treat it early, the treatment is easier, it will last longer. You might not even need treatment at all if we can prevent it from happening. But sometimes people leave it until they have a serious issue, and then the only option is to take the tooth out or to have a root canal thing, which is what we want to prevent. So yeah, really important to see a dentist regularly. At least, well, the dentist will advise you on what your risk factor is for dental decay and gum disease, so then they'll advise you how often you need to come. So some people will need to come every 3 months if they've got like gum disease or they're really high risk of getting dental decay. And some people can go up to like a year or 2 years even if they're really low risk, but that can all be assessed by the dentist.
Hmm. So then, as we move further through life, our risk, as I don't like to generalize, but it risk generally goes up the older you get. Why is that?
um I mean, as you get older, your teeth are just subjected more things, right? So the teeth are in there for a long time, going to be subjected to like constant acid attacks with your diet. Also, a lot of people grind the teeth as well, and they can wear the teeth down, so they can get other dental issues, like tooth wear, jaw problems, broken teeth, that kind of thing. So there are a lot of things that can happen as you get older, but it doesn't necessarily mean that you will get them if you get older, because there's a lot of things that we can prevent.
Hmm. Yeah. And just because obviously it is Smile Month, we get so many lovely nominations that come through all the time, and my favorite of all time was Mary from last year, who was 97 and still had all of her teeth. She'd never had a tooth removed, she'd never had anything. And it just goes to show that if you take care of them, they are going to last you. It's not inevitable that all your teeth are going to fall out, which I just think's great.
Exactly, that's really nice to hear. I mean, it's really good to have to keep your own teeth as long as possible. But yeah, that's amazing.
Hmm. Is there anything with, like we said, children have dexterity or might have issues with cleaning? Can that also be said for people who are older?
Yeah, so some people with, as you get older, may have some mobility issues, or dexterity issues with the hands, like for example with arthritis. So even holding a toothbrush may be difficult. In those cases, I do recommend electric brushes because usually they've got a bigger handle, which is easier to hold. And then the electric toothbrushes, they do a lot of the work for you. So instead of having to think about like how you need to angle the toothbrush and how to move it around the mouth, the electric toothbrush is just so simple. You just position it on the teeth, let the toothbrush do the work, and move it along the mouth. So that's really handy. You can also get other toothbrushes that cover more surfaces at the same time as well. So there are lots of things that can use to help you as you get older. There are also other issues that people can have as they get older, like maybe with medical conditions or dry mouth, so that can increase their risk of getting dental problems like dental decay and gum disease. Some people have mobility issues, so they may struggle to actually attend dental appointments. In that case, the home care routine is more important than ever. There are lots of dental practices that do domiciliary visits, so it's definitely worth checking that out and not just ignoring dental visits altogether if you can't attend. So a lot of dentists will actually attend your home if you can't, or if you're in a care home, will attend those areas and carry out treatments, carry out examinations, that kind of thing. It'll be limited in what we can do, but if we're getting them regularly, we can obviously prevent dental issues from occurring. So yeah, that's definitely worth keeping that in mind if you have any mobility issues. We do need to still take care of our teeth as we get older and still make sure we're going for a regular check, cleaning the teeth and flossing. Flossing actually can be quite a struggle for older people, with kind of wrapping the floss around their hands and putting it in the mouth in the right way. You can get special tools like a floss holder. So have you seen those ones that look like a little heart?
Yes, yeah.
Yeah, so they can be a lot easier. So you just pop them in and just pull them. So it's got a little handle. You can get ones with bigger handles that you can actually put your own floss on. And actually, have you seen those like oral irrigators?
Yes, yeah, I have. They like fill them with water and they like,
Yeah. So you fill them with water and it produces like a kind of a compressed jet of water or air and water. And that can be really useful for people with dexterity issues because it's got a handle that's bigger, and you just position it kind of in between the teeth and use that. I mean, it always is better to use like the floss or the interdental brushes, but if you're struggling, then the oral irrigators are really useful. The interdental brushes, you can get them with long handles as well. So there are lots of tools out there that you can use to, if you have some dexterity issues.
yeah, I'm really keen to try one. I see them and I'm like, oh, they look so good. They look like they would just clean your mouth like ridiculously well, and then you get that clean feeling for ages afterwards. And I'm keen to try them on a slightly separate note. I think they look really good. But it's an interesting point with electric toothbrushes as well, that you just need to like hold it and let it do its thing, because there's no like thinking, oh, I need to angle the brush, I need to do this, I need to do that. It just does it all for you.
Yeah, they're really useful, and I recommend them to all my patients. I do prefer the oscillating rotating toothbrushes, like the old B ones, and I've used them for years, and I recommend them to all my patients just because the size of the heads are perfect to get into those awkward areas, and they've got all the evidence behind them to prove that to show that they remove more plaque than manual brushing. They've got time, like you can get ones with timers on it and pressure sensors so that you're not brushing too hard and that you're brushing for the correct amount of time. So I mean, if you want to upgrade your oral health routine, it's no brainer for me.
Fantastic. I think we've discussed all that we can about how to take care of your teeth as you get older. Does being elderly put you at a higher risk for things like dental decay or other dental health conditions?
Not necessarily, but some people have other health conditions as they get older, but you don't necessarily, doesn't mean you will get those conditions as you get older, but a lot of elderly people have a lot of other health conditions that can be a contributing factor to certain things. So it's not, as I said, not inevitable, but it can be linked. And there's a lot of things that are linked, like a lot of conditions that are linked together with old age, like heart disease, diabetes.
Which is very helpful because we are going to discuss systemic diseases in a later episode. So I'm sure we'll get into that in a lot more detail later. But that is everything for now. Thank you again, Angela, for joining me. Thank you, Oral-B, for sponsoring this episode. It's been fantastic. We'll be back again soon, and we can't wait to see you then.
Thanks so much for having me again.